Hi, everybody. Welcome. We'll get started in just a moment. We'll just give it 1 or 2 minutes, see if there's a few more to join us. Great. Well, let's make a start. Thanks so much for being here. I'm Dr. Sam Morgan, and on behalf of the BNSSG Women's Health Programme team, I'm really pleased to welcome you to our training event today, focused on racial health inequalities, looking at the dimensions with a focus on Black maternal and neonatal health. These events that we're running are open to all of those working in women's health across primary and secondary care in BNSSG, and it's great to also welcome colleagues from the VCSE sector today. We've got lots more events coming over the next few months. Do keep an eye out for those and join us if you can. Today's session is going to be recorded, so please switch your camera off if you don't want to be in the recording, and please keep yourself on mute throughout. If you've got any technical issues, please reach out to Vicky in the chat and she'll do her best to support you. We'll share some key slides after the presentation, and there'll also be a link to a feedback form. Please do fill it out. It's really useful for us in terms of planning future events. Please use the chat as well to post questions as we go. Sona and Caprice will be keeping an eye on the chat throughout the presentation, and there'll be regular opportunities to make this a bit more of an interactive discussion. So please post any thoughts, comments, or questions as we go through. And I'm delighted to welcome our two speakers today, Caprice and Sona from Black Mothers Matter. So without further ado, I'll hand over to them. Thank you.
Good day, everyone. It's really nice to have this hour with you all. I'm going to ask my colleague Caprice to introduce herself first, and then I'll introduce myself and then just jump straight into it because we, hope this is a packed hour for you.
Good afternoon. So my name is Caprice. My pronouns are she, her, and I'm part of the Black Mothers Matter team. I lead on education, so I run workshops and training for anyone working within the perinatal period with a focus on anti-racism and how that will impact our practice. Over to you, Sona.
Thank you. So my name is Sona Patum. I am also part of the Black Mothers Matter team. I'm one of the founding directors and now run the organisation day to day. I hope some of you have heard of our organisation. We do lots of work across Bristol with Black women and birthers. If not, the clue is very much in the title of our organisation, Black Mothers Matter. We're here to support and celebrate Black pregnancies at a time when we continue to see huge disparities in experiences and outcomes for Black women, Black birthers, and their babies. We appreciate I think everyone here works in primary care, our GPs, so not all kind of directly related to maternity, but from our work in Bristol over the past kind of 4 or 5 years, we've got some great learning, some principles that can be definitely applied to all areas of healthcare, some best practice, again, that can be applied to all areas of healthcare. And we see the work we are doing in maternity where for lots of women, it's kind of the most intense time that they have this connection with healthcare professionals, that from our work there, we're able to influence kind of lots of other health-seeking behaviours. So it feels really relevant to be able to talk to those working in primary care. And often, and kind of something we've learned from our work as well as us ourselves working in the VCSE sector, you as healthcare professionals, we're really good at like distinguishing between different professions and GPs and midwives and things like that. But actually, for a lot of people we're connected to, those lines are a lot more blurry. So it's quite likely that a woman or birther that is attending their or seeing their community midwife, potentially in their GP practice, it all just becomes one thing that one service that they're tapping into. So it feels really relevant to be talking to you guys here. So I'm going to start with a very quick kind of bit of context as to why we're here. So I'm sure we're all aware of the health inequalities that exist in the perinatal period for Black women. I'm not sure if anyone had the opportunity to watch the TED talk that was circulated, and that kind of delved into my story and gave an overview of the context. But it's always helpful to start with this statistic that I'm sure you're aware, but Black Mothers Matter started at a time when myself and my friend who's pictured there next to me, Aisha, who's also actually a local Bristol GP. We had, at the time that we were pregnant and had our babies, as Black women, we were 5 times more likely to die during childbirth or up to 6 weeks after compared to our white counterparts. Even myself, I said that statistic so many times, but just pause and think, 5 times more likely to die. The number has reduced over time. I think we're the most recent Embrace report, it's 2.8 times more likely to die. To me, that is still terrifying. There's so much work to be done. One kind of piece of information or data that I always find really heartbreakingly telling is this chart. I'm hopeful there's kind of enough detail that you can see it, but if not, what this shows is risk of stillbirth broken down by ethnic category and level of economic deprivation. And my category is proudly Black African, so that bottom line that is a lot darker. And I am really grateful for my economic privileges. I live in a dual income household. I have a mortgage. We have 2 wages. Like we're okay. So I sit in that kind of on the left hand side. So in that least deprived quintile. But if you look at the my risk of stillbirth compared to a white woman experiencing the greatest level of deprivation, I'm still twice as likely to experience stillbirth. So with all of the resources and access I have, my child is still twice as likely to be stillborn than a white woman's who has nothing. There's through our work, we've learned that kind of storytelling is a great way to help people understand Black experiences in pregnancy, Black experiences of navigating healthcare. So we're going to share some content from a lady called Nicole who documented her pregnancy journey really beautifully and publicly on kind of YouTube and Instagram and stuff. So I'm going to share some of her content now. Subscribe, 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 subscribe to the channel.
I'm Nicole. I'm doing fine. Do you know what I mean? Yeah, the worst thing about my pregnancy is that I'm always out of breath. I could walk from here to the end of the room and I'd feel like I'm dying. Like I went to my midwife and I was like, oh my God, like, is this normal? I don't understand. She was like, yeah, you're carrying a child. There's a whole human inside of you. The baby is eating, like, I feel like the baby's eating me. Like, that's the worst thing. It's so hard.
myself, lots of other Black women really enjoyed following Nicole and her pregnancy journey. It was lovely, and rarely do you get to see kind of Black joy celebrated and things like that. But actually, Nicole is one of those statistics. So the shortness of breath that she talked about in her she talked about in that video and spoke about kind of reporting repeatedly to her midwife. There was no follow-up, and that shortness of breath was actually an underlying heart condition that resulted in the death of herself and her baby. Another avoidable Black woman died. I'm going to hand over to Caprice.
So what I think is really important is to say is that a lot of these stories hit the headlines, and we're aware of them, but actually there's a lot of stories that don't hit the headlines as well. So I'm going to share a couple of stories that you may be aware of from the last couple of years. So this image that you can see on the screen is from BBC News, and it was about a woman who was based in Gloucester, so very local to us, Rana Abdul Karim. She died 4 years ago now after suffering a bleed post-birth. Immediately after labour, I'm going to give you some more context. Immediately after her labour, she started suffering from heavy bleeding and her condition deteriorated. Something that her partner was completely unaware of, because they had been told that they had been admitted to hospital for a scan to check on her health and that she would be going back home. Okay. In fact, she was being induced. But unfortunately, there was some problems with translation, and that message didn't get across properly. Now, according to the investigation that was carried out after her birth, the obstetric team of doctors weren't told about the change in her condition for over 30 minutes, okay, which led to a 53-minute delay in getting her a blood transfusion. The investigations that followed found that Miss Abdul Karim was uninformed about her reason for admission. Her consent to induced labour wasn't given, and because she presented as quite thin and small in her body, staff actually underestimated how much blood volume that she was losing. So there's a whole host of things that had come into play here. But one of the key things that came out in all of the reports was that there was a lack of translation services available. Okay. And because of that, messages were missed. Okay. And it resulted in her death. Again, this is just one of those stories. 2023, there was another story that was based in Liverpool. In this story, the headline stated, if we could have the next slide, Sona, the headline stated that a pregnant woman died after cultural bias delayed care. Now, what that means, okay, when the investigation was carried out, hospital staff had not taken observations for this particular patient because, according to the notes, the patient was being difficult. Now, if we were to dig a little bit deeper, what might that look like? How is someone being difficult? And how might that make us react? Is someone being overly assertive? Is someone raising their voice? Is that deemed to be difficult? And when we think about some of the stereotypes that we hear around Black women being labelled as aggressive and angry, has that led to her being labelled as being difficult, which in turn led to her not having the observations that she needed? Okay. The probe that happened after her death went on to raise concerns about the impact of systemic cultural bias and stereotyping on the provision of safe and effective care. Okay. In that same hospital, another Black woman died from sepsis in 2023, and that's still being investigated because of some of the language that was used on her notes. Okay, so it really makes me think about the impact of our words, whether they're written, whether they're relayed in conversation. And when we think about us as healthcare professionals, or you as healthcare professionals, perhaps how are our words translated when we perhaps offload to someone in the staff room? Perhaps when we talk to the receptionist in the GP office and have a little moan about someone that's come in to receive some care. Okay, how are our words translated? Okay, I've got one more story that I want to share with you. This was from 2024, so this was last year, and this was the story of someone called Laxmi. Laxmi had at the time, a 6-month-old baby. She went to her GP to raise some concerns about baby's health, and when she was there, the GP referred her to the hospital. When she presented at the hospital, her baby's birthmarks, which were blue spots, were mistaken for bruising. Now, this type of birthmark is something I was born with. It's something my daughter was born with. Lots of my friends' children were born with, and it's really, really common on babies with brown and black skin. When she was referred to the hospital and they mistook the birthmarks for bruising, they called the police, followed the procedures for suspected child abuse. She was arrested and ended up in a cell for over 24 hours. Now, I'd love to know just initially if anyone's got any thoughts that they want to share, pop in the chat. I'd love to hear. Because I think one thing I was very careful in my wording there is that upon being referred to the hospital, she was arrested when medical staff followed procedures for suspected child abuse. Okay, so they followed procedures for suspected child abuse. If no one's got anything they want to share, I will give my thoughts on that. So, as I said, this type of birthmark is really, really common in children who are racialized as black and brown. Usually by age 5 to 10, they will fade. Some people just have them forever. But what we're seeing here, and what played out at the hospital, is an example of confirmation bias. Now, when I talk about confirmation bias is where we will seek out and interpret information in a way that confirms our beliefs. Okay, and it's a bias, a cognitive bias that can lead to inaccurate conclusions, which is what happened here. Now, when I talk about it's seeking out and interpreting information, because we have the internet and books and a whole host of other avenues to gain information from, we are able to find information that confirms what we think or will debust what we think. Okay, so what we saw here is something that is really, really common, and actually by just having a Google and having a look, or perhaps asking the questions to Laxmi, we could have stopped all of this happening. Okay, this didn't need to happen, but instead we didn't seek out that information to confirm what was actually true. We kind of confirmed and affirmed what the hospital thought, okay, by not double checking, and it's resulted in a really harmful situation for Laxmi and her son. Okay, and these might sound quite like dramatic stories, but I think what Sana said earlier, we have a real proximity to these stories. And although our stories and the people that attend our groups, they may not have resulted in deaths, we all have common experiences and shared experiences where we've come close or we know someone. Okay, over to you, Sana.
Just before I move on, there's a comment from Adele saying thank you for sharing these stories, and yeah, they aren't really hard to listen to, but like Caprice said, there's lots of us that don't have the option to not listen to them, to not know these stories, because they are our stories, or they're the stories of our friends and our family. I wonder, just generally, amongst everyone here, are these stories that you are familiar with? Are these news stories that kind of end up on your wherever your pages that you consume news. It would be interesting to know that. And yeah, please do use the chat function. And I hope everyone's doing okay after hearing those stories. I'm going to move on to Caprice.
Sorry, just before you do, so I think, is it Genevieve? I'm hoping I'm pronouncing that correctly. Has written, my nephew, who is mixed heritage, was born with blue birthmarks. My sister, who's white, has been questioned many times around them. Ultimately, the interrogation she experienced came from ignorance and not being educated properly about skin types or how marks can present depending on skin colour. Thank you so much for sharing. And I think this is almost well, it's a brilliant example of how so your sister has been interrogated and questioned about them, and is white. I'm guessing because of, you've not written it in the story, she hasn't been arrested and they haven't gone down the route of child abuse, whereas someone who is not racialized as white, whose child has those same birthmarks, has a completely different experience. Okay. So I think that's also, it's really interesting to think about how we may be suffering or have the same thing, but we experience it differently because of our lived experience or our racialization. Thank you for sharing that, Genevieve.
So I'm just going to talk now about some of the work we're doing at Black Mothers Matter to address all of these issues that we've seen starting to come out and themes starting to come out through these stories. And like I said before, I do hope some of you know our work and perhaps signpost some of your patients towards us. But just a quick overview. So Black Mothers Matter have various services, resources to support from all angles on the issues of Black maternal health. One half of our work is focused on services and resources for our community, and that's through the form of events, community groups, developing resources and offering kind of enhanced one-to-one support or kind of a more holistic offer to individuals. And then the other side of our work, which is just as important, is work like this. So having the opportunity to have conversations with healthcare professionals, so education and speaking, being involved with research to make sure we are increasing or improving accuracy and relevance and reach for people racialised as Black. And I will talk a bit later about Black Maternity Matters, which is another project I hope you're aware of. So again, just an illustration of some of the work we do. So this is a resource library on our website. Sorry, it includes things like access to Black doulas. There's a recipe book to support with gestational diabetes that has a bit more seasoning than some of the NHS guidance available, and lots of other things, always with a Black lens. One of our core offers is our community groups and bringing people together. And this is a lovely video that summarises or captures a little bit just how important those spaces are.
Into family where you can sort of pass the baby and everybody takes the baby and goes, hi. And, you know, it's like a bunch of aunties. All the love and all the attention is there for the babies, but it's very much about the mum, which is great because outside of this group, there's just not, you don't have that. There's not much for the mum. Okay, you know what? Take the there you go.
Within the group is such a safe place. You have women that almost like, as they enter, they take an exhale. It feels so calm and nice to be around people who look like yourself. And I know that a lot of women find it difficult when they enter healthcare environments, looking around and not seeing any other Black women or any other Black care providers. A lot of women here find it easy to ask the questions that they couldn't maybe ask their care provider because they weren't quite sure whether it was safe or whether their care provider was going to be able to tell them the information that they really needed.
Lots of our work is into family.
You don't want to hear from me. I could talk about the power of places and spaces like that in terms of addressing health inequalities for 4 days, but I just wanted to focus on kind of 2 things that those groups are delivering that are really important. And the first is about delivering that sense, or creating a community, delivering that sense of community, and community being something that feels often quite lacking in Western medicine. And this is just an example of when we first said, we're going to start this group in Bristol, and someone reaching out to so excited. So I can't express just how much I needed to read about this today. My family have just moved from London to Bristol, and trying to navigate being newly pregnant and making new friends in a community while being a Black mother in a new city is daunting. Not sure I'll make the first one, but just knowing it is there is a lifeline. You'll never know how much it means. Thank you. So many really similar messages to that, and people that maybe engage with us on our social media, and actually that is the start of a long journey of us being able to provide support for themselves through pregnancy, postnatally, and for young families as well. So that sense of community being really important, and also the kind of exchange of access between healthcare professionals and our community as well. So I am so tired of hearing that Black women are perhaps disengaged or hard to reach. That is just not the case, and I think spaces like ours really prove that point. So regularly, as part of our community groups, we have a regular rotation of healthcare professionals visiting our space. This is some pictures of Charlotte, who she's left Bristol now, it's a shame, but pelvic health physio, who was able to come to our group, offer advice, make referrals, follow up, and make her service really easily accessible for people in our community. There's definitely something about healthcare professionals going out to meet people where they're at, rather than waiting for people to come to them, especially knowing there's so many reasons why Black women lean out of services, because statutory services aren't always a safe option. So when healthcare professionals kind of lean into us, that can be really, really impactful, and it improves access in both directions. I'm going to try and speed up. So this is just an example of more of that professional work. So myself and my colleague Aisha talking to second-year midwifery students, the future workforce who will be responsible for our care. And Black Maternity Matters is a big programme we're delivering in collaboration with Health Innovation West of England and 2 anti-racist educators, anti-racist organisations, BCOCO and Representation Matters. And at the heart of this project is an insight we gathered quite early on in our work, that as a Black woman, no matter what you do to prepare yourself, you can attend, if you're talking about pregnancy, you can attend all of your scans, all of your antenatal appointments, do 10 hours of hypnobirthing a day. There is still a risk that you cannot mitigate, and that ultimately our safety lies in the hands of healthcare professionals that we meet on our journey. And that is just so applicable to all stages of healthcare. There remains a risk that we cannot mitigate, and that is with you. And this programme, Black Maternity Matters, comes from that insight and delivers kind of deep, long anti-racist education to healthcare professionals over a period of 6 months, so people have time to practice and reflect and progress in their anti-racist approach, and also task people with designing, developing and implementing small QI projects into their setting. So with the idea that if we have lots of smaller quality improvement projects implemented that address some of the issues that we've brought up, there will eventually be a big enough shift that will improve things. but I would encourage you to just Google Black maternity matters, and there'll be lots of information. Before I hand over back to Caprice, has anyone got any questions, comments on our work or anything we've shared so far? Over to Caprice then.
Thank you. So as I've had a couple of people in the chat say what their role is. So I know that lots of you are doing different roles within the NHS. But when we're thinking through the lens of like GPs in particular, you're often the first port of call when it comes to a healthcare need. So the power really is in your hands. Whether you're the receptionist that's answering the phone or the family GP, your interactions are going to have a huge impact on the relationships that people form with healthcare professionals moving forward. So before we overhaul everything that we're doing and think about making drastic changes in our practice and policy so that we can achieve a more equitable landscape, I think it's time for us to kind of hold the mirror up to ourselves and reflect on us. Thank you, Sona. So when I say hold the mirror up to ourselves, it's really important to reflect on our core beliefs. So our core beliefs are those values that kind of guide us. They are shaped by our family, our friends, the media, our education, and they help to shape our perception of the world. So I want us to reflect back on our childhood. This is a picture of Sona on the left and me on the right. And I know what you're thinking. These two kiddies are really gorgeous. You're not alone. But when we're thinking about our childhood, who taught us? Did we attend brownies or guides? Did we go to swimming lessons? What books did we read? I've always been an avid reader, and growing up, I loved the famous 5 books, and it would follow these 5 children who were always outside having adventures in nature. But actually, when I think about what that looked like, I never read a book where a black or brown person was outside having fun and exploring in nature. When I think about my education, in any kind of setting, I have never had a non-white educator. Until now, I've never worked in a workplace where my senior leadership team looked like me. And I'd love for you to think about that. And you can pop it in the chat, you can just have a think. But how many jobs have you had where the senior leadership team look different to you? So when we're thinking about all these experiences throughout our childhood, we're thinking about how they've socialized us, and our socialization shapes our perceptions and beliefs around who is important, who is an educator, who holds power, who is deemed to be attractive. And when I say who's deemed to be attractive, it makes me think quite a lot about language. How do we present and interact with people that we come across in our work, outside of work, who are European and bilingual versus someone from Iran who's labeled EAL? Because we often, when we think of certain countries where people have English as an additional language, will rush to get in place a translator. Do we hold that translation service to the same level when we're thinking of someone who's European and bilingual? Or do we think that perhaps they're more educated, perhaps they'll have a better understanding of English? And I think when we're having these conversations and I'm asking these questions, it can be really uncomfortable, and it can bring things up in us that make us feel a little bit uncomfortable. But it's really important that we're honest with ourselves and take the time to reflect. So I wanted to share a story with you. I grew up in an area called Staines. I don't know if anyone's familiar with it. Ali G put it on the map, and it's like southwest London. But where I grew up, there was a very large Gypsy Roma traveller community. And I was always told by my family, you don't go to certain areas because that's where they are. It's very dangerous. They can be quite aggressive. They're not very educated. And I grew up with these stories being told to me, okay? not as in your face as that, but very subtle. You know, perhaps I'm walking down the street with my mum, and if we saw someone from that community, she'd grab my hand and pull me slightly closer to her. It's not always with our words, it can be with our physical actions, okay? But if we fast forward 25 years when I started my teaching career, I then I was living in Bristol, and I had a large community of Gypsy Roma travellers enter my school setting. And I really had to kind of grapple with the fact that I've been brought up with these beliefs and attitudes towards this entire community. Okay. And I had to actively dismantle my own beliefs around them to make sure that I was interacting with them and in the same way that I was interacting with other children, that I was giving them an equitable education and giving these children what they deserved. And I think if we are really honest with ourselves, these core beliefs will be something that we all have to kind of grapple with as we have now moved into being adults and working. So when we're thinking about those core beliefs, they will inform something called the triple consciousness, which is what I'm going to talk about that is on the screen at the moment. So you may have a view about something at home that you feel entirely comfortable with, and you can share it with your friends and family at home. But does it align with when you come into work and the wider organization or society? Okay. Is it a viewpoint or an opinion or a bias that you have to keep to yourself? Okay. Now, when these things are in alignment, when you've got a viewpoint or a core belief that is in complete alignment with how you navigate spaces at work, it makes life a lot easier. Okay. But when your views collide and they're not particularly acceptable, okay, perhaps society knows that they are biased or just incorrect, okay, you have to work a lot harder to hide that version of yourself. Okay, and when we're doing that, it can lead to slippage. So what I mean by slippage is perhaps you share your opinion and it's really inappropriate. Perhaps it leads to some raised eyebrows. Perhaps it's rooted in a stereotype. Okay, so we need to think about how that might physically show up. Okay, perhaps it is a raised eyebrow. Okay, perhaps you don't touch someone physically in the same way that you would touch another patient. Okay, perhaps you physically back away and aren't as physically interested in the conversation. Now, I would love if anyone is brave enough or willing to share something that perhaps you grew up believing, okay, but now in present day it's something that you've had to challenge or dismantle or that you know is rooted in a stereotype. I'll give it a minute if anyone would like to share in the chat.
I wonder if anyone's going to share.
I know. Or am I going to have to do the teacher thing and just cold call someone that I can see on my screen? I don't think I'll do it yet. I'll do one more. I'm giving you the heads up, okay? The next time we've got a prompt, I will choose someone on my screen. Sona, I know that you've got something that you can share that relates to this.
Yes, I do. So I think when we first started this work and I started thinking about this, and something that I am still working on is my attitudes towards body shape and body size. And the way that comes up for me, I grew up in a household with, I grew up in the UK. There's a pretty standard beauty standard. I grew up watching certain things on TV that I will share with you. Actually, I'll share an example of some of the stuff I grew up watching on TV, and then talk about how that has impacted how I'm able to support people.
It recently went viral. I'm in Telford, Shropshire, and I'm about to meet one of the fattest families I've met in my life. These fatties haven't seen their feet for years. I'm here in the Peak District and about to meet two right massive fatty siblings who are at the peak of their porkiness.
I thought it was the Mandela effect. Like, I thought it couldn't be real.
I mean, watching that back now as an adult, I 90s TV was wild. But that was quite normal. That was normal. I'm sure there are other people on this call that maybe grew up watching similar programs with beauty standards in their head, and people in larger bodies were probably funny, but certainly not healthy, maybe not particularly intelligent, very lazy, only ate junk food. That is kind of something that just was part of my narrative growing up. The issue is, if I'm at one of our lovely baby groups and a woman in a larger body comes to me and says, I'm being tested for gestational diabetes, without having done that dismantling work that Caprice spoke of, my immediate reaction is, well, of course you've got gestational diabetes. You probably only eat fried chicken. I doubt you do any exercise. Look at you. You're fat. Whereas the reality is that's very untrue, and it's dangerous, because a better response is, in the same way, if someone who was slightly slimmer, my first reaction might be to share information about how maybe gestational diabetes can be managed through diet. Should be a similar type of advice I'm given to that other person, but that doesn't always happen if you haven't done the work.
I'd love to know if how it made people feel hearing or watching that video clip. So again, feel free to pop it in the chat. I won't call on anyone yet, but if we are all of a similar age, in late 20s to early 40s, this was something that was on TV all of the time. And very, similar ilks of, makeover shows, getting them from those Cinderella stories, overhauling people's wardrobes and makeup to make them look a particular way. And yeah, I think it's really interesting looking back on those shows. So we are going to have a look now and jump into the concept of race and racism in the context of your work. The first thing I wanted to do was show you the dictionary definitions of racism. So on the left is the dictionary definition, and on the right is the social political definition. So have a little look at that, and I will talk through it. But when we're looking at the difference between these two definitions, the dictionary definition focuses on someone's individual beliefs and actions, and it's defining racism as discrimination against someone based on their race or ethnicity. Okay, it almost it's saying that anyone can experience that racism, okay, regardless of their race. When we're thinking about the social political definition, okay, it's going beyond that. It's looking at the systems and structures that are in place, okay, and it's looking at the combination of prejudice and power. So when we're looking at the social political definition, okay, it's about the wider systems of inequality and power that impact groups of people based on race, and the people that are impacted by racism because of those systems are people racialized as Black. Okay, so when we're thinking about racism, okay, we usually split it into 4 dimensions. So the 4 dimensions of racism are institutional, structural, interpersonal, and internalized. Now, when we're thinking about those 4 different headings, when we're thinking about institutional, we're thinking about policies, procedures, education. So coming back to the comment that Genevieve put, that the mismanagement of the blue spot birthmark was down to lack of education, because we aren't having that proper education. When we think about structurally, we're thinking about institutions as a collective, as society. When we think about interpersonal, we're thinking about the more obvious, that overt and covert racism. We're thinking about those microaggressions that no doubt so many of us will be aware of. And when we think about internalized, again, it kind of makes me think back to that advert where we've heard so much negativity around fat bodies, how does it feel to be in a fat body, applying for jobs, you know, trying to help and support your patients, if all you've been told is a negative rhetoric, okay, around the way you look? So we're going to delve a little bit deeper, and I'd love to hear some of your examples. You probably will have more examples that relate to your role. So when we're thinking about institutional racism, and I go back to the policy and procedure and training, one thing that always stands out to us in the perinatal period is the use of the APGAR test and the APGAR score. So for those of you that aren't familiar, it's a test that's carried out at 1 minute and 5 minutes after birth that looks at the perfusion of a newborn. Now, when we look at the language that's used in regards to this, the scoring, they use different language depending on which trust you're in. It could be pale, the child is presenting as pale, or pink, or blue, or normal. What is normal? What skin tone are we deeming to be normal? Okay. And how accurate will this scoring system be for children who are dark skinned? Okay. Their normal is going to look completely different to a light white skinned baby. When we think about the African pelvis, and again, it comes back to that education, we worked with a trust recently where one of the midwives, her husband was a doctor or a surgeon, and he came home and was saying that he'd had a conversation and was talking to a trainee about a patient who had an African pelvis. And that's the notion that women from Africa, their pelvis is shaped differently, and that will have an impact on their birthing experience. Now, we know that this is completely inaccurate. There are 4 different pelvis shapes, but they don't correlate with race or the African pelvis, okay? But this isn't something that has been passed down in education from those who have been working within this space for 30, 40 plus years. And it's now trickling down to people who are trainee midwives, trainee nurses, okay? So when we're thinking about that dimension of racism, we're thinking about overhauling education as a whole, okay? When we're thinking about institutions, it also makes me think, someone in the chat said I think they work in mental health, and the Mental Health Act released some statistics in 2021 that said that Black individuals are over 4 times more likely to experience restrictive interventions like restraint or isolation in hospitals than their white counterparts. 4 times more likely. And we really have to question why. And it makes me think back to one of the conversations we had at the very beginning of this, and the stereotypes around Black people being deemed to be angry or aggressive in comparison to someone else who is passionate and emotional and raising their voice to get their point across. How are they viewed? Okay. When we think about institutions as well, some more statistics that we found was that there's huge disparities when it comes to access to treatment. Black adults have the lowest treatment rate at 6% compared to their white counterparts, which is at 14% for mental health problems. When we think about the structural dimension of racism, okay, so things like gelatin in medicine, okay, society as a whole, we are just used to and expect that, okay, but how will that isolate certain communities? Okay, will they feel comfortable accessing healthcare if they know that the medication is not going to cater for them? What languages are spoken? Again, coming back to that conversation earlier, when we're thinking about translation services, who are they offered to? Okay, who is able to access them? One thing I think is really interesting is when we think about leadership, and I said how many people have had a senior leadership team that looks like them or doesn't look like them. When we think about those leaders, that kind of pyramid of power, we're seeing a lot of change since 2020, a lot of change at the bottom, where lots of businesses have had huge EDI programs and have recruited lots of different diverse people, but actually the decision makers at the top, okay, of these pyramids are not changing. And if the key decision makers all look a certain way, then there'll be certain priorities when it comes to policies that are rolled out. Something that we found really interesting, but not that shocking, is last year 5 times more money went into research into erectile dysfunction, which affects 19% of men, versus PMS, which affects 90% of women. Because why would a board of white men invest in PMS? It doesn't impact them and it doesn't affect them. Okay. So I think when we start really looking into these different dimensions, we could probably think of a whole host of different examples that impact your work. I'm going to go on to interpersonal, and then I am going to call on someone to see if they would share anything that they've noticed about the dimensions, perhaps something that is relevant to your workplace. So interpersonal, that's when we were talking about those microaggressions, and something that we see so often is that mispronunciation of names. It seems so small, like it's not that much of a bigger deal, but actually when this is something that is happening day in, day out, multiple times, it's so tiring. And actually when you're getting tired of something, yeah, you might get a little bit annoyed and frustrated. Okay. The Race Equality Matters did some research and into adults in the workplace, and found that 73% of adults that had their name mispronounced on a regular basis in their workplace. And this is something that could be rectified so easily when we think about your work and all of the paperwork and forms that we have to fill in. Perhaps having a phonetic option underneath. We've seen in maternity wards that they have stickers where you can write phonetically. We've seen lots of businesses and organizations have that as the default on their name badges at the bottom of people's emails. And if we get into the habit of making these small changes, okay, a bit like what Sonna said at the very beginning, these small changes will add up and begin to have a huge impact on us as well as our service users. When we're thinking again about interpersonal and those microaggressions and that overt and covert racism, something that I always come back to is that's come out of all of the reports around Black maternal health is the disbelief of pain. And we're still hearing that in people are being taught in their education that Black people have stronger skin, have thicker skin, okay, don't feel pain in the same way as their white counterparts. Again, this is incorrect, but this will lead to people not receiving the level of care that they need, not receiving the medication that they need. Perhaps they've experienced that and it's put them off accessing healthcare in general. Okay. I think it's really interesting. Kenzie has added into the chat that when they were at medical school, the education was so focused on white-skinned people. The foundations were already being laid for biases within future doctors, because how confidently and competent are we to diagnose things on dark-skinned children, on dark-skinned adults, if all of the education we've had has been through a white lens, focusing on white skin? Thank you so much for sharing that, Kenzie. When I think about breastfeeding, after the birth of my daughter, I was very passionate around breastfeeding. I did a breastfeeding course. It was a 6-month-long course. Throughout that 6 months, I did not see one image of a Black breast. So when it came to things like diagnosing mastitis or supporting someone with mastitis, I didn't feel equipped because I had not seen an image of a dark breast and how that skin condition might present. Okay. Thank you so much. So Adele has also written about so the resources that are available: plasters, steri-strips, they're all designed for white skin, and that is the default option that we fall onto. So I'll move on to internalize. So again, those comments that people will get on a regular basis. Gosh, you're so articulate. Your English is so good. I love your hair. Is that your hair? Gosh, you've changed your hair again. All of these things are comments that are wrapped up in kindness, okay, and in niceness. Actually, what are people trying to find out? What are you trying to ask? What are you actually trying to say? And we have to carry that, okay? Because if we were, as a dark-skinned person, if I were to go through life confronting all of these comments, goodness me, I'd be exhausted. I'd probably be quite angry. So it's having that facade of, again, you having to receive these comments in a nice way and accept them and answer them, okay, to not be deemed confrontational. When I look at biased job applications, there was a interesting article, a whistleblower article that came out in 2023. I would urge you to have a look at it. If you Google the Bristol Cable, and we'll put it in the chat, Bristol Cable NHS whistleblowing experiences. It spoke with lots of people who work across the 2 trusts in Bristol who are racialised as Black and brown about their experiences within the NHS, where they were passed over for promotion, where they were mocked, perhaps they were spoken to in negative ways. They experienced racism from their peers as well as people that they were helping within the community. And I think it's really interesting, and I'd urge you all to read it, because we can say all of these things, that these are people working in Bristol, in the 2 trusts, and their own experiences. So definitely have a look at that online if you are able. When we're thinking, again, something that's just popped up, sorry, it's just I'm on a roll now, but I also am highly aware of time. When we're thinking about structurally and how society as a whole and societal racism, there's so many factors that can lead to an inequitable healthcare. So things like social isolation, inadequate housing, poor nutrition, all affect how people access healthcare and the quality of that healthcare. So research was undertaken by the Runnymede Trust and Greenpeace in 2022 and 23, and it identified the impact of climate crisis on white people. So there's areas that are deemed to be air pollution sacrifice areas, and these exist. And in these areas, there is a lot of low-cost private and social housing, very high levels of deprivation, limited access to green spaces, and these spaces are made up of a highly diverse demographic of people, where they are housed next to things like recycling centres, incinerators, industrial sites, and the air quality is terrible. So we then wonder why these communities are presenting with higher levels of things like asthma or respiratory problems or other healthcare issues that are impacted by how they live day to day, because society has created these different environments for them. I'm going to take a breath because I feel like I've not taken one for about 10 minutes. Has anyone got anything they would like to add in regards to how any of that fits into their work or their practice?
If no one wants to share now, I think reflecting back on these different dimensions and where you can start to see them show up in your day-to-day living and work can be a really helpful start point to starting to address some of these issues. And sometimes when you kind of break it down like this, it feels hugely overwhelming, and it's like that thing of, if I'm just one person seeing X amount of patients a day, what difference can that make? But truly, in the position you're in, it can make all the difference. And it can literally be a matter of life and death. So I would encourage you to reflect back on this and how it kind of, this model fits into your life and your work. Right, we've got 1 minute, Caprice. Go.
Yes, well, we have what I'll also add is that we have a follow-up session in a month's time, which is going to be a lot less of us talking, a lot more of you talking, where we're going to reflect back on this session, how hopefully it will have impacted your practice, or perhaps the conversations around your dinner table, perhaps it's just giving you some food for thought. So we'll do that in a month's time. But what we will say is that this is not a training session on anti-racism. We are not now all anti-racist, and there isn't a certificate that you'll get, but it's more of a journey. This isn't a moment, this is more of a movement, okay? This journey from the fear zone to the learning zone to the growth zone is something that will ebb and flow. Perhaps one day you'll feel more confident and you can be an active ally and stand up for something that is not okay. Perhaps it's someone within your own family, because sometimes that is often the hardest place to start, with those that you are comfortable with, being an ally in that sense. But there'll be other days where it's slightly more difficult, okay? And you aren't ready to feel uncomfortable, okay? And that's okay. But what I think is important, like Sona said, we reflect on those dimensions of racism. And if you're left wanting more and not knowing what to do next, we've got some really brilliant resources that we really recommend. These are some really fantastic books and authors. If you aren't a reader, then they're available on like audiobooks. If you're not into audiobooks, I'd think about, and when we were talking about core beliefs, you know, who educates us, where we read, where we listen, where we get our information from. Think about your social media. Perhaps you might follow these people on social media. Perhaps you could listen to some different opinions that differ from your own. And I'd definitely urge you to do that. But what we will do is we'll bring this to a close now. We've got some lovely comments in the chat, so thank you very much, everyone. We'll bring this to a close, and what we will do is send out the dimensions of racism slides, as well as some of the resources that we'd recommend that you take a look at if you are able. So thank you very much to everyone. Thank you very much to everyone in the comments. And yeah, we're looking forward to the next session in March.
Fantastic. Thanks so much to you both. That was really, really great session. Stories are so powerful, aren't they? I think just to really share experiences and to get people thinking. And you're right, it's super uncomfortable listening. We don't want to believe this is happening in 2025 in the UK, but it is. And you know, and I think it's just so important for us to stop and think and reflect, and you know, and just have this time to acknowledge, and from there hopefully we can all develop and improve our practice and our understanding. So thank you, both of you. And yes, we'll look forward to getting back together in a month's time. So yes, thanks for joining us today, and I hope you can all make the next session, and we'll see you all then if there's no more comments from today. Thank you.
Thank you. Bye.